Hello everyone, my name is Hasna Lutfia Fitriani. I'm from the Faculty of Medicine Yarsi University in Indonesia. Me and my friend Karina Ajeng would like to thank you to AETCM for this big opportunity to present my emergency case presentation about the complex febrile seizure with anemia. Febrile seizure is the most common type of childhood seizure disorder which occurs in an age-specific manner and is associated with a fever of 38 degrees Celsius or higher with the evidence of any definite causative disease. Based one of journal in 2014 about the prevalence and severity of anemia stratified by age and gender in rural India said that children with febrile seizure were 6.73 times more likely to have anemia compared to febrile children without seizure. And from the previous statement, we can know from the same journal in 2014 that the prevalence of children 6 months until 5 years are more prone to febrile seizure, and peak incidence is 18 months, which overlaps with the peak incidence of iron deficiency anemia, which is from 6 until 24 months. This condition happens because of the rapid phase of growth between 4 and 12 months. It makes iron stores have been reduced by half, so that the exogenous iron, or for instance the nutrition, is required to maintain hemoglobin concentration. We can see from this map that the prevalence of iron deficiency anemia among children below 5 years old in Indonesia is about 40 until 45%. This condition is very dangerous because WHO states that anemia prevalence of more than 40% is severe public health significance. Alright, to the clinical case. 8-month-old baby boy was brought by his parents to the emergency department with a seizure complaint from approximately 30 minutes before entering the emergency department. Seizures only occur one time, and the length of the seizures was about 30 minutes. During the seizures, the patient's body trembled, and when the seizures happened, the patient was unconscious. The patient's mother confessed before the seizures that the patient had a high fever, and before that, the patient also got fever since 4 days ago and already been treated. Besides, his mother said that the patient also gets a cough since the first day before entering the emergency department with a lot of sputum and has shortness of breath. The patient also has a diarrhea since 3 days ago, and the frequency of the diarrhea is 5 times a day without blood, stool, and vomit. The patient only has upper respiratory disease based on the past medical record. During this time, the patient's parents' discipline was to carry out basic immunization for the patient on schedule. First examination, we got the vital signs of this patient. Those are: patient is unconsciousness condition with low blood pressure, low oxygen saturation, and pulses, and respiratory rate, and also high in temperature. From the physical examination, it was found the sunken fontanelle that could be caused by dehydration. The conjunctiva is pale, and the pupils are also anisocoria, and the reflex of light is negative in left pupils. The thorax examination has ronchi sound from his lungs and also no neurological impairment signs from this physical examination. From the laboratory examination, it was found that the patient had low hemoglobin with the decrease of MCV and MCH, and also we got a high blood glucose and low in sodium level. From the clinical case and medical history, physical examination, laboratory examination can be concluded that the diagnosis of this patient is complex febrile seizures because of the criteria of complex febrile seizure fit to this patient from the duration, type of seizures, and unconsciousness during the seizure. Second diagnosis is microcytic hypochromic anemia, and the third diagnosis is gastroenteritis with mild dehydration. And fourth diagnosis is suspect bronchopneumonia. Thorax X-ray should be done because there is a sign of bronchopneumonia. An iron level examination should be done too to rule out another possible microcytic anemia. A child who has a febrile seizure should be seen by a doctor as soon as possible, especially in the emergency department, to determine the cause of the fever. And first of all, we should do ABCD, airway, breathing, circulation, and disability management as an emergency protocol. And for this patient, the management such as oxygen, symptomatic treatment like antipyretic we give the patient is paracetamol, anticonvulsant like rectal diazepam, and because of there is sign of bronchopneumonia, the antibiotics like ampicillin should be administered. And also for the diarrhea is zinc syrup. And related then, we should monitor our patient to always check his vital signs, seizure signs, urine output, and also shortness breath observation. Febrile seizures are a major cause of emergency facility visits and the most frequent neurological disorder in the pediatrics. Iron is an essential nutrition for proper growth and development in children. Iron deficiency interferes with the function of many organs, leading to anemia, abnormal growth and behavior, and also cognitive deficit. Iron status may also reflect general health including nutrition, growth, and immunity in children. From this case, this baby is good in nutrition, but in the immunity aspect isn't good. It is because of his past medical history, he had an upper respiratory infection gradually, which means the possibility of iron deficiency of this baby is higher. The role of iron is presumably more than erythropoiesis. It is recognized that even with the anemia, mild to moderate iron deficiency has adverse functional consequences, one of which is altered neurological function. From this condition, we can know that iron deficiency is a factor which can cause anemia and febrile seizures. One of study proposed the reduced brain tissue which can make iron concentration altered cerebral energy metabolism through loss of electron transport and inefficient ATP generation. A case control study conducted in Iran in 2016 which reported that 45% of febrile seizure patients had iron deficient anemia. And one of study in 2013 showed that 50 patients with febrile seizures had a tendency of 6.303 times to suffer from iron deficiency anemia compared to control patients. And also, one of prospective case control study in 2019 indicates that iron deficiency but not iron deficiency anemia was more prevalent in children with febrile seizures compared to controls with febrile illness but not seizures. The education for this condition, we can use these letters. C. Convincing the parents that good nutrition is important for healthy, especially iron, for the brain and blood function. P. Provide understanding to the parents about the need for further treatments. And then, patients need proper evaluation to find the cause of seizures. And then, providing antipyretics immediately. And also, providing anti-seizures medication at home. G. Go to the primary healthcare or hospital immediately when the first seizures occurred. The education given to the patient's parents by the doctor can further reduce the number recurrence of seizures, anemia, and also the morbidity of the children's disease. Finally, the conclusion of this case report is iron is an essential nutrition for proper growth and development in children. Iron deficiency interferes with the function of many organs, leading to anemia and cognitive deficit. The prevention of underlying causes more effective in reducing the number recurrence of seizures, anemia, and also the morbidity of the children's disease. Thank you for your attention. Bye-bye!